Welcome. We are so glad that you are taking a few minutes out of your day to learn more about specialized foster care with the Developmental Disability Service at Oklahoma Human Services. What we want to do today is just give you some basic information about specialized foster care and what that looks like, and hopefully give you something to think about to see if this would be a right fit for you and your family. So we'll jump in with some of our key requirements. One of the first ones is that you do have to be at least 21 years old. The next one is that we do want you to be able to be a stay-at-home parent. So what that looks like is we consider you a professional parent. And so this would be your full-time job. We do have some exceptions for employment, but if you are able to, we really want you to be able to stay home and support that individual that's placed in your home. The next thing is that we do have you submit information for background checks and fingerprints. There are things that we look for that we can't work with, but there's a lot of things that we can work with. So if you have any concerns about any criminal background that you may have, please still reach out to us and talk to us, and we'll see if that's something that we can work with to get you approved as a foster parent. Another piece that we have is training. So as a SFC parent, we want to make sure that you are fully trained to care for any individuals that are placed into your home. What that looks like is that we set up training for you that you do prior to having someone placed in your home. And then we also have some annual training for you to do after that. So that way you can stay up to date on your skills. Next is that we ask for you to provide an individual bedroom for each person that is placed in your home. So if you have 2 extra bedrooms at your home that are free that someone could stay in, we could place 2 individuals with you. Overall, for specialized foster care parents, we usually don't place more than 3 people in a home, but we can always start out with just 1 person. So don't worry that we're going to drop 3 people in your lap. The last thing is that we want you to be able to participate in a home profile. And what this looks like, it's just a story about you and your family. And we'll go into that more in depth here in a second. So I mentioned the home profile a minute ago, and this is something you may have heard of before. It's sometimes called a home assessment or a home study if you've been around this field at all. And it really is just a story about you and your family, anyone else that lives in the home, and what it looks like for you all in your day to day. We get some history from you about how you were raised, if you have your own children, how you raised them, as well as where they're at and what they're doing now, about your relationships, your supports that you have to help you through this journey, as well as your ties to the community. It's something that we complete through questionnaires, through interviews, through forms. So there's a lot of ways that we get information from you, but you are involved in this process every step of the way. There will be someone from our unit that comes out and walks through this and completes this home profile with you. As I mentioned, we do have some forms that you are required to fill out, and there may be some additional documentation that we gather from you, such as a driver's license, auto insurance, things like that. But don't worry, we try to keep it as minimal as possible. So a few things that we talk about, attributes that make really great specialized foster care parents we wanted to cover with you today. The first one is that we look for individuals who are caring. So if you are one of those people who is a natural caregiver for your friends, for your family, you're the one that people look to when they're sick or when they're sad or when they need support in some way, you might be someone that would be a great fit to be a specialized foster care parent. We're also looking for individuals that are compassionate. The folks that we work with here at DDS, they have intellectual disabilities. And that means that sometimes they communicate in different ways. Sometimes they don't communicate like we do. And we have to learn how to communicate with them. And that takes compassion, figuring out how to best communicate. They may have needs that we have to help them with, such as their daily living skills, getting dressed, eating, things like that. So being able to understand that they just need some help and support and we can provide that is something that we look for. Also, just as with most of our daily lives, we look for people that are flexible. No 2 days are usually ever the same as a specialized foster care parent. And that might mean that something happens during the day and you have to shift what you're doing. The individual in your home may need to go to the doctor. They may decide that they want to go on an outing and be in the community that afternoon. And so being able to be flexible and adjust to what that individual needs is really important. The next thing we look for is someone who's a strong advocate. And maybe you're thinking to yourself, I don't know how to advocate for someone with developmental disabilities. The great thing that happens when you become an SFC parent is that you'll learn those skills along the way. And what we really want you to be able to do is to speak up for that person that's placed in your home. You're the one that will be with that individual the most amount of time. And so you're the one that's going to know them well. And we just want you to be able to help be their voice in meetings and to speak for them whenever decisions are being made. Some of our individuals are able to voice that on their own. And so you can be that person that's encouraging them. Some of our individuals may not be able to voice that. So you get to be their voice. So we're looking for those people that are able to do that for the folks that we work with. And lastly, we want to have folks that are welcoming. So again, if you are someone who hosts the holidays, who has people over for the block party or the barbecue when the big game is on, you're welcoming to those around you. You may be a great fit to be a specialized foster care parent. This is a big job to have someone come into your home, live in your home, and become a part of your family. So we're looking for individuals that are welcoming, that are ready to have someone become a part of their family. We hear that constantly from our SFC parents, that someone started out as a placement, but they quickly turned into family. And they stay with our our individuals stay with our families for quite some time. And so that's what we're looking for, is individuals that are families that will welcome our individuals into their home and make them feel like they are a part of the family. So let's talk a little bit about a day in the life. When we think about what does it look like as a day in the life of an SFC parent, it really just starts off like any normal day like you would do. So you're going to help that individual complete some of their daily living skills before going to school or work. So this looks like maybe helping them get dressed, maybe helping them brush their teeth or shower, helping them with breakfast. And when I say these things, it's going to vary based on each individual's needs. We have some folks that really you don't have to help out with that much getting them dressed, other than making sure that things are buttoned correctly or their shoes are tied. But we have other people that need more help. So it really does vary. But we want to make sure that that's where kind of we start our day, getting them ready to go out into the world, to go to school, to go to work, whatever that may look like. We also have you take that individual to doctor's appointments, to therapy appointments, whether it's physical therapy or speech therapy, occupational therapy. You are that person that is in charge of their health care. So you're making sure that any of those needs that they have are met and taking them to those appointments as they are scheduled. Another thing is we want you to interact with whoever is placed in your home just like they're a member of the family. So if you have a family that comes in from out of town and they stay with you for a week and you just envelop them into your family like you would someone else in your home, this is what we want you to do with the individuals that are placed in your home. We want you to make them a part of the family. So they're involved in those family activities. They're eating dinner with you. They're playing games with you. They're going on weekend outings with you, whatever that looks like for your family, that individual is treated as a member of the family. And then also a really important part of DDS's mission is that we are making sure our individuals go out into the community, that they don't just stay at home, that they aren't relegated to, being in a bedroom or a living room or something like that, that they're out in the community, they're meeting other people in the community, whether that is they're out running errands. Maybe they're getting to know individuals at the grocery store, at the pharmacy. They're going to places like church or community organizations that have activities, going to the movies, just everything that you would do to be an active member of your community. We want to make sure that the individual placed in your home is also included in those things. So I mentioned earlier that we do have training that we provide to you as an SFC parent. And so the first part of the training is done online. It's done through the College of Direct Supports. There are modules that you are assigned that you complete. You do this on your own timetable. So if that works out for you to be in the evenings or the weekends or maybe in the mornings, whatever that looks like, you're able to complete that at your own pace to get completed. Then we also have a few different in-person trainings. One of those is our CPR and first aid class that's completed prior to approval and then also completed annually, so we make sure those skills stay up to date. We have a medication administration training class that you go to. It is completed every 2 years. Again, this is going to teach you how to administer medication, how to document the medication that the individual is taking, so that way everyone has an appropriate record, and you go through that every 2 years. And then we also have some specific individual training that you may need to do based on the individual that's placed in your home. An example of that might be if you have an individual placed in your home that has a feeding tube, then what that looks like is that we provide you with the training to know how to administer the nutrients through that feeding tube, how to make sure that everything is done at the right time and at the right pace. And so we make sure that you have that training prior to that individual coming into your home so you feel comfortable then administering that. So that's just one example. There are other examples of what that looks like. Not everyone has individual training, but some of our individuals do, and we want to make sure that you do have that before the individual is placed and feel good about it. So next up, I mentioned earlier that as an SFC parent, we really consider you to be a professional parent, and we like for you to be able to stay home to provide care for the individual. And so we want to make sure that we are paying you for that service. And so what this looks like for specialized foster care is that we have a daily rate of $77.22. And so you get paid back each day that you provide specialized foster care services. You also receive a monthly room and board rate, which is $570, which comes out to about a $2,800 monthly average that you receive as payment for being an SFC parent. This is very similar to self-employment. So as an SFC parent, you are not an Oklahoma Human Services employee. You do not work directly with Oklahoma Human Services. And so it is like you are self-employed, which means you are responsible for any type of long-term financial planning. So that is something to consider. But this is kind of what that payment looks like. And again, this is for one individual if you had one individual placed into your home. A few of the benefits that we offer to our specialized foster care parents are that we do allow up to 720 hours of respite annually. And if you aren't sure what respite is, that's really just a break. It allows you as an SFC parent to have a break from caregiving. That means your individual would go to another approved home. They would stay there for, the day, the weekend, whatever that looks like for you. Maybe you are going on vacation and that individual is going to go to respite for a whole week. We're very flexible with respite. So you're allowed up to 720 hours annually, which is about 30 calendar days. And when it comes to respite, we can help you find respite, as well as if you know someone who might be willing to provide respite, we can get them approved to do that. And we'll talk about that as well in a minute. We also offer therapeutic leave, and that's up to 60 calendar days per year. And what therapeutic leave is, It means that if the individual in your home is out of your home for 24 hours or more, you can still get paid for that day, depending on why the individual was out of the home. So if the individual had a medical event and was in the hospital for a week, you could still be paid for those days while the individual is in the hospital. If the individual is in respite for the weekend, you could be paid for the days that that individual is in respite. So it's just another way for you to still be paid for SFC, even though that individual is out of your home. You also get reimbursed for transportation when you are transporting the individual. So we talked earlier about that day in the life of an SFC parent. When we talked about that, we discussed you being the person that is taking them to those appointments, to the doctor appointment, to the therapy appointment, taking them out into the community. Whenever you are doing those things, you are able to be reimbursed for transportation. So those are a few of the benefits that come with being a specialized foster care parent. So I just talked a little bit about respite, and I want to hit on it again. So we do have an opportunity for people to come in as an SFC respite provider. And we talked earlier about respite care. It's that short-term relief for our primary carers. And so it gives them a break, allows them to rest, recharge, that sort of thing, maybe take a vacation. And we need to have respite homes in order to have enough folks to provide care for our individuals when our SFC parents need that break. When we talk about respite, it is very flexible. It can be for just a few hours a day to, like I said, as long as a week or possibly more. So maybe you just need respite for 4 hours for an afternoon because you want to go get your haircut and go to a movie. Then that's fine. We can look for respite for those 4 hours. Or if it is something like a vacation, we can look for those longer times. So we're always looking for respite providers that are willing to provide respite. To be a respite provider, you do have to be approved as an SFC home. So earlier when we talked about the requirements and talked about all the things you have to do, like the home study, the background checks, the training, you do have to do all that to be a fully approved respite provider. But then you're able to provide respite for any of our SFC homes, which is a wonderful thing. Our respite reimbursement rate is $108.68 daily. We have an hourly rate if someone just stays for a few hours, but primarily we work on that daily rate of $108.68. And one thing to consider is that like I said, we need respite homes. So if this is something that you're thinking about, we would love to talk with you more about it. So we're going to go through a few questions real quick. And these are some of our frequently asked questions before I show our final slide that gives you information on how to reach us. So one question that comes up often is, what is the difference between traditional foster care and specialized foster care? Without getting too technical, traditional foster care is really working just with child welfare and children in the child welfare system that are not usually eligible or approved for developmental disability services. And so the individuals that we work with in specialized foster care, these are individuals that can be children or adults that have some type of diagnosed intellectual disability. And so that's really the primary difference, is the individuals that come into specialized foster care, we are under the Developmental Disabilities Services program. So we're not under a child welfare program. It's just under developmental disability services. Anyone that is placed in our home or our homes has to have an identified intellectual disability. So those are probably the primary differences. There are some other differences, such as the reimbursement rate is different between traditional foster care and specialized foster care. The ages that we serve are different because in specialized foster care, we serve children that are ages 3 all the way through adults. And so we have individuals in our program that are anywhere from 18, 19, 20 all the way up to 80 years old. And so that's another big difference is what that looks like. Another frequently asked question is what kinds of disabilities do individuals in SFC usually have? And so when most people think about developmental disabilities or intellectual disabilities, one of the big ones is Down syndrome. We do have some individuals that have Down syndrome that are in our program, but those aren't primarily the individuals that we work with. We see a lot of individuals that have diagnoses of autism, of cerebral palsy, that have developmental delays that are kind of overarching, just an overall developmental delay. Whenever we think about our individuals with developmental disabilities, we do have a fair amount of individuals that also have occurring medical disabilities as well. And that could be something like I mentioned earlier, such as a feeding tube, or we have individuals that may have seizures that we have to watch out for. Different things like that. We have some individuals that have toileting. They need help with toileting, that they're learning how to do that, or maybe they're not going to be able to do that on their own. So those are just a real high level look at what some of the disabilities that our individuals in our program might have. Another question that people have is they hear about this and they think, I'm kind of interested, but this is a big commitment. I'm not sure if I'm ready to do that yet. How can I help? What can I do? And we really try to encourage you to consider being a respite home. Whenever we talk about respite, we always need respite providers. We have a great need for that. As you can imagine, being a full-time parent to an individual is a lot. If you've raised your own children, you know it's a lot. You've needed a village to help you out. And we are always looking for more people to add to our respite village. And so if you're thinking this might be for you, but maybe not full-time, please consider being a respite home. Like I mentioned earlier, respite looks very different based on the individual that's going to respite. It can be for a few hours, it can be for a weekend, it can be longer. The great thing about being a respite provider is that we just check with you to see if you're available. If you aren't available because you're out of town, that's okay. We'll call you the next time we have a respite need. If you are, unavailable because someone in the family is ill, that's okay. We'll call you next time. So being available is important, but life happens, things come up, and that's okay. So really it's something to consider being respite. If you do respite and you feel like, okay, I've gotten my feet wet for a year, 6 months, whatever that looks like, I'm ready to take on a full-time placement, then we are more than happy to, look for that full-time placement for you. So another question that comes up is, what if the placement is not a good fit? And that's a really great question because a lot of folks wonder, well, what do I do if I get someone in my home and we realize that this isn't going to work out for whatever reason? And one thing I want to make sure everyone understands is that here at DDS, we do our best to make sure that it is going to be a good fit by having meetings beforehand. So we want you to meet the individual. We want you to be able to have a couple different in-person meetings with them to get to know them. If at all possible, we try to have at least one overnight visit to see how that goes, to again, help figure out, is this individual going to fit in my home? Am I going to be a fit with that individual? So we do our best to make sure that it is going to be a good placement, but sometimes we know that things happen, right? And we decide this isn't going to work out for whatever reason. Maybe it's something, with our family that it's not going to work out for this individual to stay here. Or maybe you realize this individual has some needs that I'm not able to meet and they would be better met somewhere else. If that happens, you come to us, you talk to the team, you talk to your case manager, and then what we can do is start looking for another placement for that person, because we want to make sure that it is beneficial for the individual as well as you and your family. So if you get in that situation that's not a great fit, you just talk to us, let us know, and we'll start brainstorming on how we can find a better placement for that individual. So the last thing I do want to share with you, here's some information about how to reach us. If you have additional questions, please email us at our dds.ssc.ac@okdhs.org email. We check that email daily. We can respond to you. We can answer questions, or if after watching this you decide, I'm ready to jump in, let's do this, I want to get the process started, you can let us know and we'll take it from there. The other thing you can do is to visit okfosters.org/foster care/specialized foster care. It has some additional information as well as one or two different videos about families that have done specialized foster care and their experience with that. So please don't hesitate to reach out to us if you have any questions, because we are happy to answer those, to answer as many as you have, talk you through the process, and we really hope that you will consider joining this really great program with DDS. We are always looking for more specialized foster care parents. So if you think that this might be a really good fit for you, then reach out to us and we'll get the process started. Thank you so much. We hope you have a great day.